my client feels stiff in his low back, and what I'm doing is finding the PSISs, okay, and that defines the middle of the sacrum of the sacroiliac joint, the S2 segment, and the joint is shaped like a boomerang. So this is the bottom of the angle of the boomerang at S2 level. And the sacrum, we know from the literature that the sacrum does forward and backward bend. Even the most conservative authors will admit that it does do that movement. Not a lot of movement, but it does do that, and therefore it should have a little bit of spring mobility. So I'm coming up above that level. I'm on the top of the sacrum. He's prone, and I can actually take up the slack, and I can actually spring it forward, okay? Now I'm going to come to the lower sacrum, and I identify the tailbone, and I come at least 1.5 inches, 2 inches above. I'm on the lower sacrum, and now I'm testing backward bending of the sacrum, spring mobility, and I can take up the slack. I see his heels move medially, so I know the force is going through the SI, down the hip, down the legs, and then I can spring it, okay? What I'm going to do is now test him at end range positions. So I'm going to have him get in a child pose yoga position, okay? So go ahead and get up and...
This way?
Yeah, yep, beautiful. And he's got excellent mobility. So PSISs are right here, okay? And what I submit is that the human body should still have a little bit of joint play even at end range of flexion and end range of extension. So I'm now above S2 and I'm thrusting firmly, and there's force transmission. And now I'm on the lower sacrum and I can translate movement through the sacrum. Now I'm going to have him get up in cobra position. So now we're getting him up in extension. What's interesting is that he has noted over the recent past, is that true, that you've lost the ability to go into cobra as far as you used to?
2.5 years right now, my hips would be all the way down and my shoulders would be at least 4 inches higher.
Okay, okay.
That's gone.
Yeah, so you've lost extension of the lumbar spine.
Absolutely.
Okay? Well, what I want you to do is come down and keep your pelvis on the table. Yeah, nice. So he's up on his elbows. Okay? And now I'm going to test sacral mobility. So when your spine extends, the sacrum should forward bend. Okay? And in this position, at the bottom of the sacrum, you should have a little bit of spring mobility, and you do, okay? You should also have a little bit of spring mobility going anteriorly. I cannot take up the slack. I can't. There's, you know, I'm doubling, I'm tripling the amount of force there, and it's just not happening. And now I'm going to come up onto L5. And I can't take up the slack on L5, I can't spring it, and even at end range extension it should have a little bit of joint play. I'm at 4 now, and you can see that on 4 I can still take up some slack, and I can still get a little bit of thrust mobility. Do you feel the difference?
Yes,
okay?
Absolutely.
So,
and I'm not even at full extension, I'm pretty close.
You're pretty close, yeah. So what I'm suggesting is that your sacrum is actually having a predilection for backward bending, and it's lacking forward bending mobility. So I'm going to put 4 pillows under your chest and keep you up in extension, and then I'm going to lean on the sacrum. So here's 3 pillows to put under your chest. So now you're going to be passively extended. You okay with that? All right? And then I'm going to put a pillow under your ankles. Lift your feet up. Okay? And I'm going to set a time.
You know where that hurts? My iliotibial, my T-band.
Okay. Are you okay now?
Yeah, it's okay.
All right. So I'm going to set a timer, but if it bothers, tell me. And I'm simply going to isolate the PSISs and then put the heel of my hand above that at S1, and I'm going to very gently lean onto it. And if I were pushing on a bathroom scale, this would be about 20 pounds. Okay, so I'll stop filming now, and I will do that treatment for 2 minutes, and then we'll reevaluate it.